Positron emission tomography PET scanning plays a pivotal role in the evaluation and management of solid tumors by providing functional imaging that complements structural imaging modalities like CT and MRI. PET scanning, often combined with computed tomography, PET CT, uses radio tracers like fluorodeoxyglucose FDG to assess metabolic activity in tissues. Here are its roles in detail. 1. Diagnosis. Detection of malignancy. PET scans help differentiate between benign and malignant lesions by identifying areas of increased glucose metabolism, a hallmark of cancer cells. Identifying unknown primary tumors. In cases where metastatic disease is evident but the primary tumor is unknown, PET can help locate the origin. 2. Staging. Assessment of tumor extent. PET scans are used to determine the primary tumor's size and metabolic activity. Detection of nodal and distant metastases. PET CT is particularly useful in evaluating lymph node involvement and distant metastasis, especially in cancers like lung, colorectal, and esophageal cancers. It can detect occult metastases missed by conventional imaging. Evaluation of whole body tumor burden. A PET scan provides a comprehensive overview, aiding in accurate staging and treatment planning. 3. Guiding radiation therapy. PET CT aids in defining target volumes for radiotherapy by accurately demarcating tumor boundaries. Selection of biopsy sites. It identifies the most metabolically active regions within a tumor, which are often the best targets for biopsy. Treatment modality decision. It helps in determining whether a tumor is resectable or if systemic therapy is more appropriate. 4. Monitoring treatment response, assessment of chemotherapy or radiotherapy effectiveness. PET scans can evaluate early metabolic changes in response to therapy, often before structural changes are visible on CT or MRI. Distinguishing residual disease from post-treatment changes. PET is useful in differentiating between viable tumor tissue and treatment-induced fibrosis or necrosis. 5. Restaging and surveillance. Detection of recurrence. PET CT is highly sensitive in detecting recurrent disease in patients presenting with symptoms or rising tumor markers. Surveillance in high-risk patients. It aids in early identification of relapse in asymptomatic patients with high-risk tumors. 6. Prognostication, assessment of tumor aggressiveness. Higher standardized uptake values, SUVs, on PET are often associated with more aggressive tumors and worse prognosis. Predicting survival and outcomes. PET data can provide prognostic information based on the metabolic activity of the tumor. 7. Specific tumor types. Lung cancer. PET is a standard component of staging and evaluating treatment response. Lymphoma. It plays a critical role in staging, interim response assessment, and post-treatment evaluation. Colorectal cancer. PET is used to detect recurrent disease, particularly in cases of rising carcinoembryonic antigen (CEA) levels. Breast cancer. It is helpful in detecting metastases and recurrent disease in certain subtypes. Head and neck cancer. PET CT is invaluable for identifying primary tumors, evaluating nodal involvement, and detecting distant metastases. Limitations and challenges. False positives. Inflammatory and infectious conditions can mimic cancer on PET due to increased metabolic activity. False negatives. Some tumors, like low-grade lymphomas or mucinous carcinomas, may show low FDG uptake. High cost and limited availability. PET scanning remains expensive and may not be readily accessible in all settings. Conclusion. PET scanning is a transformative tool in the management of solid tumors, offering unparalleled insights into tumor biology and metabolism. Its integration with structural imaging modalities, particularly in the form of PET CT, has significantly improved diagnostic accuracy, treatment planning, and monitoring. However, its utility should be balanced against its limitations, and its use tailored to individual patient scenarios.